Hi, welcome to this session. My name is Dr. Mary Binoy and I'm from Envertus Academy. So today we'll be doing a writing session. I will be telling you how to choose relevant matter from a case note and then make it into a letter. So when we do this, we have a lot of doubts on what's relevant, what's irrelevant. So I'll be clearing all that. Plus, we'll be doing a known case today. So we're going to find out how we know it's a known case and how to differentiate between a known and an unknown case. So before that, let's wait for the others to join us. Just wait for a couple of minutes. Just see how they're joining in. Yeah. Okay. Like I said, today's case is a known one. So how do we find out? We have several conditions to let us know whether it's known or unknown. One of it, of being a known case, is when it's written patient's GP or patient's oncologist or patient's gynecologist, which means it's a known case. So instead of patient, they can give the pronoun and say his or her GP, or they can say the patient's name. Say the patient's name is Mary Bell. So they could say Mrs. Bell's GP or Mrs. Bell's oncologist or radiologist. So this way also you get to know it's a known case. Another condition is when the address of the patient and the recipient are same word to word. You can't just say, if they're on the same street, you can't say it's a known case, but say the patient is staying at a nursing home and the patient has maybe had an accident in the nursing home. Say he or she has fallen, and you're taking the patient to a hospital and then referring back to the nursing home. So obviously the patient's present address, or the address where the patient is staying and the address to which we are sending would be the same word to word, which means it's again a known case. So these are the conditions when you can say for sure it's a known case. Well, coming to a case note and writing, I hope you remember the criteria. So I just go through it once more. Maybe it would be helpful, I know. So the criteria are purpose, content, conciseness and clarity, genre and style, organization and layout, and last, language. So these are the criteria. And I hope you know how you have a format. So just see the format of a letter, so how it goes. So you know the format as well. Now, the only task left to us is to do the choosing. So as you know, on the case note, you have the first few lines which says it's a writing subtest for nursing. The time allowed, the reading time is 5 minutes and the writing time is 40 minutes. So as you are aware, during the 5 minutes, you're not supposed to use your pencil. You can just read through. So me just reading through, I kept my pencil away and I'm just going to read through the case notes. So the case note says the name of the patient. So you start with, you're a registered nurse taking care of Mr. William Burrows after his surgery. The name, Mr. William Burrows, age 42 years, date of birth 3/1/1966, admitted 19/12/2008, discharged 29/12/2008. Reason for admission, crushed right patella. The patient history, knee reconstruction after boating accident, operation successful, discharged today. Then the social background is given. Now, I am not going through the social background. As you all know, if it's a known case, the social background is not relevant, which means the social background need not be taken while writing the letter. So as a whole, I'm just leaving out the social background. But if you want, you can just go through, no issues going through it. So, but it's not necessary, as you must realize that it's not necessary to write. So we go on straight to the nursing notes where it says successful operation, routine post-operative recovery, pain controlled by self-regulated pethidine, wound healed, sutures removed, mild infection, Bactrim, 4 tabs, TDS. Depressed about inability to work, crutches used with difficulty. Going on to the discharge plan, physiotherapy for knee, strengthening upper body and arm to support crutches, requested exercise program, pre-accident, no regular exercise, bed rest for 2 weeks, gradual return to usual daily activities, home help for 2 weeks, stairs at home problematic with crutches, 4th floor flat, may need wheelchair, arrange loan, health insurance forms to be forwarded to insurer, work safe, may pay patient salary for time off work, monitor wound for continuing infection, more Bactrim needed, then psychological support for depression, speak to employer about date for return to work. The writing task says, using the information in the case notes, write a letter of referral to the patient's GP, Dr. Nick Kershaw, City Medical Center, Elizabeth Street, Melbourne. In your answer, expand the relevant notes. Do not use note form, use letter format. Well, this is the entire case notes that I've just read. Now we go on. Our 5 minutes, probably our 5 minutes are over. You can use your pencil. So when you can start with using your pencil, you first go to your writing task. Before the writing task, obviously, you have to see what is the scenario or the background information. So you're a registered nurse taking care of Mr. William Burroughs after his surgery. So you realize that you are a registered nurse. You're going to underline the registered nurse because that's your designation. Then we go on to the writing task. In the writing task, write a letter of referral to the patient's GP. So this is where we come to the conclusion. This is a known case. The patient's GP's name is given, Dr. Nick Kershaw. So you need the address as such, Nick Kershaw, City Medical Center, Elizabeth Street, Melbourne. Okay, so now you have a little bit of information about it being a known case. You have to go into the discharge plan to know what all would be required. So since you're writing to the patient's GP, probably you would have to write everything that he needs to know because you have to keep him updated. It's his patient. So it's written physiotherapy for knee, yes. Strengthening upper body and arm to support crutches. Requested exercise program, yes. Bed rest for 2 weeks. Home help for 2 weeks. Stairs at home problematic with crutches. 4th floor flat, yes. Health insurance forms to be forwarded to insurer, work safe. May pay patient salary for time off work, yes. Monitor wound for continuing infection. More Bactrim needed, question mark. What does a question mark say? Where it just says that it might be needed. So we are not telling that the Bactrim is to be given, but just see, you have to monitor the wound. It says monitor the wound, and if required, Bactrim has to be administered. Yes. Then you go on to the psychological support for depression. Speak to employer about date for return to work. Yes, we have ticked all that. We go back to the first page where we start with the name, yes, which is required. Both age and the date of birth are given. Date of birth is much preferred because it's more reliable. So date of birth, yes. Then the admission date, the discharge date, the reason for admission, patient history. Okay, then we go to the nursing notes. The social background, not required because it's a known case. Yes, the nursing notes say successful operation, pain regulated, okay, wound healed, sutures removed, mild infection, depressed about inability to work, crutches used with difficulty. The last 2 points could be linked with points given in your discharge plan. So now we've got a clear idea about what has to be written. So we'll go on to how to write this entire or convert it into a letter form. Okay, so we go on to the letter. Well, the letter says, so as you know, the format of a letter, how did we start with? We start with either today's date or date of discharge. Then you go on to the recipient's name, designation, and address, followed by the reference, which is the patient's name along with the age or date of birth. Now we have chosen date of birth here, so we write the patient's name and date of birth, followed by the salutation. So to whomever you're writing, dear doctor and whatever, the name. Then you start with the introduction, go to the body paragraph, followed by the next paragraph, which would be history. But since we don't have that in a known case, we are eliminating that paragraph and we go straight to the recommendation paragraph. So basically, we've got just 3 paragraphs. We have to know how to divide the letter into this and see that one paragraph is not bigger than the others. I mean, you have an introduction paragraph, obviously just 2 lines, but then you write the body paragraph. See that your body paragraph and your last paragraph or the next paragraph after that, do not have a lot of difference in their sizes. So don't have too many lines in one paragraph. You need to divide it logically. Okay, so let's start off with the letter. And as we start, the first line says 29th December 2008, followed by the doctor's name, designation and address, which is Dr. Nick Kershaw, General Practitioner, City Medical Center, Elizabeth Street, Melbourne. Then you go on to the leave a line and then you write the reference, which is the patient's name along with the date of birth. So it is reference Mr. William Burroughs, DOB, 3 January 1966. Now we start with the letter. Dear Dr. Kershaw. So in the first paragraph or the introduction paragraph, we know we have the 3 P's. Just let me remind you what the 3 P's are. So the first P is patient's full name. Second is the present situation or present condition of the patient, followed by the last P, which is the purpose. Why are we writing, or what does the recipient have to do? So let's just formulate that. I'm writing to update the current health status of Mr. William Burroughs, who is recovering after a surgery. He requires comprehensive management following his discharge. So here we have written all the 3 P's. We have written the patient's full name. We have written what is his present condition. So he is recovering after a surgery. And what is required by the from the recipient is comprehensive management. Well, we have done that. So we have completed that. So this is one way of writing your introduction. Let me give you a few more ways to write the introduction. Okay, so there are other ways. You could write it this way. Thank you for seeing Mr. William Burroughs, a known patient of yours who is recovering after a surgery. Okay, he requires comprehensive management following his discharge. So that's one way of writing it. Let's just check out another way of writing it. I am writing to refer Mr. William Burroughs, who is recovering after surgery. He requires comprehensive management following his discharge. He is a known patient of yours. So in all these 3 introductions, you see, we have said that this is a known case. We've said it in different ways. However, we have expressed it. So this is how you write. When you get a known case, you can write it in 3 different ways. I've just shown you. Please take a note of it. Okay, now we go back to the letter. We see how we write the letter as such. So we have done with the first paragraph. We go on to the second, that is the body paragraph. We start with Mr. Burroughs was admitted on 19 December 2008 following an accident. He underwent a knee reconstruction surgery. So at this point, I've written the name of the surgery. If you have written the name of the surgery in your introduction paragraph, please don't repeat it here. So I have not written it in my introduction. So I've written the name of the surgery here. He underwent a knee reconstruction surgery. His post-operative period was uneventful. However, he had a mild infection which was managed with Bactrim, 4 tablets, thrice daily. Please look at where I have used the commas. I have put it after Bactrim, after 4 tablets. Okay. Therefore, his wound needs to be monitored to check whether he needs to continue with Bactrim. So this is where I've combined what had to be, what was given in your management plan with here, this sentence here. He is depressed regarding his inability to work, for which he requires psychological support. Again, I have combined two ideas. He uses crutches with difficulty, owing to which he needs physiotherapy for the knee as well as strengthening of his upper body and arm to support the crutches. So here also I have combined. See how I've combined? The reason why I have combined is if we were to write all this in the management plan would have been way too long. So to prevent that, I have added whatever could be done here itself. Now we go on to the last paragraph, which says, it would be appreciated if you could do the further management of Mr. Burrows. Please note that he has been advised to take bed rest for 2 weeks and avail home help during this period. Kindly note that he requested for an exercise program. Please note that he may need a wheelchair as he needs to use stairs to reach his flat on the 4th floor. Okay, and then we go on to kindly note that his health insurance forms needs to be forwarded to the insurer. Please note that his employer needs to be informed as he may receive salary for his time off work and the date for him to rejoin for work. So these are the things that must be notified to the general practitioner. Probably he needs to know about it, but he would be assigning others to look into it. Probably a social worker needs to be looking into this, the salary part and for him to rejoin for work. So, but he needs to be notified. So I've notified all that. Then we go on to the last line, which says, if you have any further queries, please do not hesitate to contact me. And then you have the signing off with yours sincerely. We use yours sincerely because the name of the recipient is given. So it's yours sincerely. The name is not given, it's yours faithfully. Yes. And then we end the letter with your designation, which is registered nurse. So yours sincerely, leave a line and registered nurse. So that's how we basically write a letter, which is a known case. So here you would be, I'm sure you're very clear about how the letter has to go. How do you choose? How do you, get these materials into all these sentences into a letter format? When you get it into a letter format, there are times that you might feel confused. Do I need to put this in the management plan or do I need to put it in the body paragraph? Well, if you were to put all the last into the management plan, it would be, as I just mentioned, too long. So that's why we included it into the body paragraph and divided it equally. So I hope you understood what was being told. If you do have any queries, anything that needs to be clarified, please do write to us. Okay, and please keep practicing a lot of letters. The present day letters, that's the real-time letters that come for exams, usually have known cases, but you don't know, those cases have in between, you see that the GP sees the patient and then he's again sending back the patient to an unknown person. So, in between you have the known portions. So it's a little bit confusing. I will be coming with letters like that probably in my next sessions. But please keep practicing. If you are planning to write the OET exam, please keep practicing, especially the letters which become a little bit confusing. Practice it and ace your exams. I will be seeing you in another session. Till then, take care and bye. Thank you.